Hi everyone, my name is Eileen Theng, and today I'll be talking about the multi-state outbreak of human salmonella infections linked to live poultry and backyard flocks. Before I get started, I would like everyone to be aware that this outbreak has ended. However, it is an extremely relevant and important public health case to be aware of because many Americans continue to raise live poultry in their backyards as of today. So first of all, what is salmonella? Salmonella is a bacterium that typically lives in humans and animal intestines and is shed through feces. Humans are usually infected by this bacterium through contaminated food or water. Now that we know what salmonella is, we'll go over the statistics for this specific human salmonella outbreak. According to the CDC, approximately 363 cases were reported across 43 states and Puerto Rico. Ill persons ranged in age from younger than 1 year to 95 years. In addition, 33% of the individuals who were infected with salmonella were hospitalized, and 73% of ill people reported they had contact with live poultry in the week before their illness began. So what do all of these numbers show? That many of the infected individuals were possibly unaware of the consequences that may occur when raising live poultry in the comfort of their own home. As a result of raising live poultry in backyard flocks, it led to a multi-state outbreak of human salmonella infections. This was an issue and will continue to be in the future due to the fact that 13 million Americans have hopped on the backyard poultry wagon. The strength within the outcome of this outbreak is that public health organizations such as the CDC has taken initiative to inform consumers who own live poultry to obtain good hygiene and properly contain their animals. However, the weakness is that many individuals continue to ignore and overlook the benefits of taking proper care of their animals and themselves. Although there is a weakness that authoritative figures are unable to control at the moment, there is opportunity to further educate the general public regarding the harmful effects that malpractice and hygiene can do to an entire household. Also, there is opportunity for the government to take action in terms of passing new laws, bills, or policies. The threat in this situation would be the population of those who own live poultry and potentially their surroundings. The CDC is the main organization with a mission to save lives and protect people from health threats. The root cause of this outbreak are the malpractice of proper hygiene techniques and live poultry care. This may include inadequate hand washing, allowing live poultry inside their household, and more. The CDC's National Antimicrobial Resistance Monitoring System, or NARMS laboratory, conducted an antibiotic resistance testing on salmonella, and samples were collected from 11 infected patients. As a result, 18% of the isolates were resistant to tetracycline, an antibiotic that fights infections caused by bacteria, and 82% were susceptible to all antibiotics on the NARMS panel. The outcome of this study allows for the public to maintain a serene attitude and response to the outbreak. The theoretical perspective that applied most of its constructs to this case solution in particular is the health belief model. Perceived susceptibility was seen when the CDC conveyed the ill health consequences of salmonella. Alternative solutions include having the U.S. Department of Agriculture's Animal and Plant Health Inspection Services investigate the outbreak as well as identifying key role models in the agriculture industry. The recommendations are to introduce awareness campaigns to the general public involving role models in the agriculture industry, as well as to promote law enforcement in regards to live poultry household regulations. A goal should be made that by 2022, There are more restrictive policies and regulations regarding live poultry within the U.S. Department of Agriculture's Animal and Plant Health Inspection Services. By 2023, it should be mandatory for all owners of live poultry in their households to be educated about proper animal care, as well as the potential consequences they may face by doing an online licensure course. And personally, I am not too concerned about this outbreak, as it is an extremely preventable with good hygiene practice and awareness of your surroundings. Lastly, I believe that salmonella outbreaks can be prevented in the future if the general public receives the education regarding proper live poultry care. And that's it. Thank you so much for listening.